Welcome, everyone. Thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 10 new cases of COVID-19 in Windsor and Essex County. 4 are community-acquired, 1 is travel-related to the U.S., and 5 cases are still being investigated. We have had 16,830 cases since the beginning of the pandemic. 60 people are active at this time, with 5 of our active cases being a variant of concern. To date, 1,962 preliminary or confirmed variants have been identified in Windsor-Essex County. 16 people are currently in the hospital, and 6 people are in ICU. Unfortunately, we are reporting an additional death today. A woman in her 70s from the community has passed away. We have lost 435 people to COVID. There are currently 2 outbreaks in Windsor-Essex County, 1 workplace outbreak and 1 community outbreak. As we move to step 2 today, I would like to provide a summary of our enforcement activities for last week and the past weekend. Overall, we followed up on 31 complaints and conducted 44 inspections. 6 charges were issued. 3 were related to mask compliance in common areas of multi-dwelling units, and 3 charges were for indoor dining at restaurants. Now for the vaccine update. 273,095 people have received at least 1 dose of a COVID vaccine. Overall, 74.4% of adults 18 years of age and older in Windsor-Essex County have received at least 1 dose of a COVID vaccine. 156,631 people in Windsor-Essex County are now fully vaccinated. That is nearly 45% of our adults 18 years of age and older. Those 18 years and older who received their first dose of an mRNA vaccine on or before June 2nd are able to book their second dose of an mRNA vaccine at one of our mass vaccination clinics, participating pharmacies, and primary care providers. You must have a minimum of 28 days between your first and second dose. Youth 12 to 17 years of age are not eligible for a shortened dose and must wait 8 weeks to receive their second dose. Today, at the Unemployed Help Center at 6955 Cantillon Drive, they are hosting a COVID vaccine walk-in clinic from 9 to 3 p.m. Those 12 to 17 years of age are required to register in advance by calling 519-944-4900, extension 166. Youth are able to book an appointment to receive their first of Pfizer vaccine doses at any of our clinics. Today, the vaccine clinic at Devonshire Mall will be offering special walk-in times for youth 12 to 17 years to receive their first dose. Signage and notifications will be in place, so please take the opportunity to get your vaccination. Please note that walk-ins cannot be accommodated at the Sportsplex. This site is ramping down and will be integrated into the Devonshire Mall vaccination site. Please do not attend the Sportsplex unless you have a booked appointment. To book an appointment at a mass vaccination site, please visit wevax.ca or call 226-773-2200. Moving forward, we will have live stream on Fridays at 9:30 on YouTube, where Dr. Ahmed will present the weekly epi summary. And for the last time, I will turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Thank you, Teresa. Good morning, and thank you for joining us today. Today, Ontario entered step 2 in the reopening framework, and now we can expand our outdoor activities and also resume some indoor services with a small number of people. Please note that while we still have many restrictions in place to ensure the safety and well-being of everyone, we still have to wear masks in all the public indoor spaces. We still have restrictions with gathering limits. Even if you are fully vaccinated, please remember that not everyone will be vaccinated. Please be mindful of the seniors or people who are immunocompromised or people who cannot get the vaccine for any reasons. We must care for everyone in the community, and if you're still waiting for your vaccine, please get your vaccine. Thank you.
We'll now take questions from the media. Today we'll start with Windsor Star.
Good morning, Doctor. Good morning, Teresa. Teresa, this is your last day. How are you feeling?
I'm feeling good. I woke up very aware that it's my last day, and already I've had 2 meetings, and it's kind of like a normal day, but I am aware it's my last day, and it feels good. I was hoping to report 0 cases, but I'm feeling good.
I know we've been asking you to do this often lately, but it's difficult to wrap up an entire career as you've had in a few words. But maybe can you reflect on even the last few years and being a part of the team you're part of?
Yeah, I know tomorrow will be like my first day off in a long time, and I think I will have a day of reflection as about many things, and I will think, I'll think about what the past few years have been, but I especially will think about the amazing senior leadership team, our middle management team, our staff. It's the relationships that we've built this past year that have really come to shine to support our whole community. All of the partnerships with our municipalities, our hospitals. Windsor Regional Hospital has been beside us with the vaccine rollout, and all of the partnerships and healthcare providers and everyone in the community. So it's just thinking of everything together, but I think it'll all, over the next few days, I'll relive a lot of it, but it's just been really good to work alongside people that are so dedicated and committed to our community.
Thank you, and congratulations, Teresa.
Thank you.
Any questions from AM 800?
Dr. Ahmed, in regards to stage 2 reopening, what are your biggest concerns? Are you worried that people will ease off on the masks, gathering limits, stuff like that?
Yeah, so my concern is, I kind of touched on that in my speaking notes, is exactly that, as we open up, not everything is opening up. So please be mindful of what you can and what you cannot do. Still, it doesn't mean that all the risks are gone. There's still a certain level of risk that exists, and some situations are more riskier situation than the others. So just be mindful of that. And as I said, our case counts are relatively stable in our region, but we still see some cases daily. So it's something to be to keep that in mind. And also, when we are saying even we have like maybe 76% of coverage rate with 1 dose, and more than almost 45% coverage rate for 2 doses for all the adults in the region, there's still a certain number of people who are not vaccinated or not fully vaccinated. So when you are engaging in any kind of activities, there is still a risk that you might be exposing yourself to. So make some of those decisions, right decisions, in terms of choosing what public health measure that you are following in which type of environment, and more specifically, every time when you're meeting with people who do not live with you, there's a certain level of risk involved. So please take all the precautions as you need to, and enjoy everything safely.
Teresa, for you, what's the first thing you're going to do while you're retired tomorrow?
Well, I'm hoping I get a good night's sleep, and tomorrow I have no plans, but I will probably go for a long walk, and nothing special. I'll enjoy a day off like everyone for Canada Day, and do a day of reflection. I really think it'll start to hit me tomorrow about everything. So it'll be a quiet day.
Thanks, Teresa. Congratulations. Sorry, just to clarify. So moving forward, not sure if I heard it correctly. these daily briefings will only be held on Friday moving forward?
Yes, that's correct. Dr. Ahmed will do the EPI summary on Fridays and give an overview and answer questions.
Perfect, thank you, congratulations again.
Thank you.
Any questions from CTV?
Yes, good morning, and congratulations on your retirement, Teresa. Are we at the point where you hoped we would be at when you announced your retirement a while back?
That's a good question. I remember trying to figure out when we could get first doses completed for everyone. And we're not quite there yet, because I do realize there are people that still require first doses. But I think we're a lot further than I thought we would be, because we're doing so well with even second doses and full coverage. So I think our whole community, all the pharmacies, healthcare providers, all the mass vaccination sites, the hospital ourselves, have done a great job with the vaccination rollout. So I think that we're a lot further ahead than I thought we would be. But it's good. It's good. And to be opening, to be at step 2 as well. We have come so far, and I just, recall where we were last year, and it was just, just really beginning, and we've come a long way, all of us.
Thank you. And do you know when the next vaccine eligibility increase will be for the region?
So the province has essentially opened up. What we're waiting for is some more information, possibly on the 12 to 17-year-olds and their dose interval. But essentially, it's opened up to anyone who has received their vaccine 28 days ago. So even though we say June 2nd, we're just moving ahead with anyone who's eligible 28 days from their, first dose. As of, the next grouping, we will continue to kind of work on that kind of approach right now. So it's not open for everyone, but we're getting there. We're continuing to move forward. We probably still have another 50,000 that are outside of the group that have opened up, that we've opened up to.
Okay. And Dr. Ahmed, what are your thoughts on Dr. Kieran Moore's comments that we shouldn't move too fast into step 3 and wait the 3 weeks in step 2 before reopening any further?
Well, I guess the plan was already laid out in terms of what the appropriate time and interval is to see the impact of each stage of reopening. We have done that in the past too, that every time when when there are some restrictions relaxed, then there are some implications in how people, when they're coming in together, what kind of risk it increase. So overall, it's not a new plan. It's nothing different. I think it's just reiterating the importance of how important it is for us to continue to move forward rather than moving backwards. What would be more devastating if we move forward and then eventually only to close it down again? We are already seeing some indications in UK, Israel, where they still have a high vaccination rate. But with the Delta variant spreading quickly, they're cutting down some of those or maybe reintroducing some of those restrictions. So we definitely don't want to close again after reopening. So that's why it is important that we open up in a manner that allows the system to adapt quickly, people to adapt quickly, and also give the opportunity for people to get fully vaccinated. We are in a much better spot, as I've indicated many times, with our coverage rate. We need more, especially in the younger age group. We have a very high vaccine coverage rate for the seniors, but we have still have a relatively low coverage rate between the 25 to 40 years individuals. So that number needs to increase. That proportion of people need to have a higher vaccination rate, especially if you're looking for these activities. So the critical part is opening it up safely and without putting any unnecessary risk, only to close down again.
Okay.
And Canada put out that guidance on Friday about masks.
But now the World Health Organization urges fully vaccinated people to wear masks as the Delta variant surges in some areas. What are your thoughts on that?
So we have dealt through this type of issue throughout this pandemic, and a lot of that is dependent on your local transmission, local geography, local situation of vaccination. World Health Organization, when they are coming out with their guidelines, it's intended for the entire world. Canada is one of the leading country in terms of a higher vaccination coverage rate for first dose people, and also get on track to get the second dose coverage rate highest among the key developed countries. So our situation is different. Canada's response to pandemic has been different as well. Many countries, many European countries, even US, have seen devastating impact of COVID-19 and then how many lives were lost. We did much better than many countries in the world. So our response has been great. So I think as much as I can see what their concerns are, the WHO's concerns are, but it's for the entire world, which have very different situation with respect to transmission, vaccine coverage rate. Here in Canada, our situation is different, so we'll take that, we'll respect that guidance from WHO, but at the end of the day, we'll have to look at what is our situation and what works for our community.
Okay, thank you.
Any questions from CBC?
Yes, good morning, and congratulations, Teresa, on your retirement today. You mentioned that youth aren't eligible for a second dose at that shortened interval and must wait the full 8 weeks. I'm not sure who's best to answer this one, but can you explain the reasoning behind that? Is it purely logistical, or is there any kind of scientific reason for delaying those second doses?
I can start and just say that the shortened second doses for youth 12 to 17 are available, are allowed in those areas that are experiencing Delta variants. And so that has been the direction right now through the province, and that's what we're following. But I'll defer to Dr. Ahmed to add anything further.
Yeah, no, similar to what Teresa said, is there are areas that have opened up, and throughout this vaccine response, there are certain categories, there are certain timeline, age band that we have used to open up vaccination as we continue to progress through the vaccination file. And so that's one of the main reason. And if you look at the provincial direction, it basically says it is open for anyone that is 18 years and older. The idea would have always been for these children to be fully vaccinated before they go back to school. So that's always there. There were some ongoing information that was collected for the potential risk to children with respect to pericarditis or myocarditis, and that has also played a contributing factor in terms of making the decision using the best available scientific data that we have. So far the data doesn't point to any additional risk for children, other than the rare events that some of these countries have experienced. And the recommendation continues to be based on the risk and benefit, and the risk the benefit clearly outweighs the risk that is associated with that. So having said all of that, I think those were some of the factors that went into the decision making of shortening the interval for these younger children. I anticipate that there will be more clarity in terms of the specific interval for these children will come from the province. But at this time, as we have followed all the other categories, other criteria in terms of opening it up for younger children, it's based on the supply and the policy decision from the province.
Thank you. And just to be clear, do you think that all health units will eventually move to the 28-day interval for all age bands?
That is correct. That's exactly the hope, and hopefully some of this information will come out very shortly. I can't tell you when, but the conversation has been happening. It was prioritized at this time for regions that are seeing a higher Delta variant spread, but eventually it will be expanded to all of the other regions as well.
Thank you very much.
Any questions from CFTV?
No, thank you. I just wanted to wish Teresa a happy retirement. Enjoy your last day of work.
Thank you.
Any questions from Blackburn?
Yes. The Royal Society of Canada commissioned a study that suggested that the COVID-19 death rate across the country could be 2 times higher than reported. I wanted to get Dr. Ahmed's comment on this. It's been a long time since we've had a big pandemic like COVID-19, and I guess it's only natural maybe some deaths may go undetected. What are his thoughts of the idea that the death rate could be 2 times the rate that's reported, though?
Yeah, thanks for the question. I can't specifically answer in terms of what the actual deaths could look like, but every time when we are reporting our numbers, our cases, our deaths, it is very difficult in terms of how do you characterize, how do you define. So in our epidemiology, we always go with the case definition. So how are we defining the case? Who is a case and who's not a case? Similarly, what is a death by COVID or caused by COVID, attributed by COVID looks like versus the deaths that are happening for other reasons. So those are always the question that we try to dig deeper and try to make it consistent for the purpose of counting and especially counting across the board. It is obviously based, there are some limitations, but also in any kind of pandemic, there are people who are actively seeking healthcare. There are people who are getting tested. And then there are people who may not feel the need to get tested. And even if they're sick, they may attribute it to something else. And if God forbid, if they die from it, they won't be captured in any record in any system. So there is a possibility for quite a lot of people who may have died as a result of COVID, but not necessarily captured. I can't say that it would be twice the number that we have seen. It may be more than what we have seen so far, but I can't tell you that it would be twice or what would be the missed cases that are not reported.
Thank you very much. And my second question is for Teresa. Again, congratulations on your retirement. I think I speak for all of us when I say you're going to be missed. Do you have any advice for Nicole as she takes over?
Well, I have worked with Nicole for the past 7 years, and so we have shared our thoughts and exchanged many, confidences and also our thoughts on many aspects of public health. And so I think that we've done that all along, and my advice is to take one day at a time, and she knows that I will always support her. So I am not leaving. Well, I'll be traveling eventually, but I'm available always to support Nicole, and she knows that that I'll always be there for her. So I think we've worked so closely together that we're very all of the good advice we've shared with each other over the years, and especially over the past year and a half. So taking it one day at a time has worked for us through this pandemic, and doing the best we can. And I think she's already there.
Thank you very much, Teresa.
Thank you.
Any questions from Radio Canada?
No. Once again, congratulations to Teresa for everything, and wish you all the best.
Thank you.
Any additional questions from the Windsor Star?
No, thank you. And again, congratulations, Teresa, especially for doing these broadcasts. I know at one point they were every single day, and I can only imagine what it was like to step into the spotlight to such an extent. So thank you very much and congratulations.
Thank you.
Any additional questions from AM 800?
No, thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
No, thank you.
Any additional questions from CFTV? Any additional questions from Blackburn?
Nope, just have a wonderful Canada Day.
Any additional questions from Radio Canada?
No, thank you. Have a good day.
Thank you, everyone. We'll see you on Friday.